My wife and I were married for 45 years. We were never apart. I used to nurse my wife because she had cancer. I did a magician act and came home and felt very tired. Then I phoned up the doctor and he took one look at me and said, "You've got to go to hospital." Now this was very difficult because my wife was now left here on her own. My wife was supposed to go into a nursing home for a respite care, but they decided to take her into hospital. So I didn't see very much of her, but they did bring me over actually on the day that she passed away, and I saw her and I sat there with her for about an hour or so, and they said, "Well, she's gone, you know. We think she was waiting for you." When I came home, I just felt terrible, really, and lonely, and nobody to speak to. It was just not the same.
More and more patients with long-term conditions and living older, we try and address their medical health problems, but it's their social care issues we've not previously been able to address directly. Over the last year or so, we've developed a system called a huddle, whereby we meet with other healthcare professionals. We discuss patients more holistically than just rather focusing on their medical needs.
So these are usually people who, for whatever reason, are unable to manage their health conditions.
Silverani came from Age UK and visited me sometime in January and suggested that she'd like to work with me and see where we could go from there.
Hello, Mr. Scarlett.
Robert's goal was to live more independently in his home, and initially he was saying, I can't get out, I can't do anything, I'm trapped up here.
I stayed in bed really for a couple of months. I used to walk to the top of the stairs and look down the stairs and think, no, I can't do it, I can't do it. And then one morning I thought, right, I've just got to walk straight out of the room and straight down the stairs.
Engaging with the pharmacist through the huddle was really beneficial to Robert.
They came and they showed me how to take all the medicines and which order I should take them in.
Robert was improving his mobility, but it was very cold, and that was because he didn't have heating in his home. So we made representations to his letting agent and heating was installed in his home.
Since the intervention of the huddle, and in particular the support of the PIC, Robert has become more independent. We've noticed his use of our service has lessened. He doesn't require an ambulance to take him to hospital appointments. This feels like the right thing to do. This type of work should be rolled out more widely to support more and more potential patients like Robert.
I get a tremendous sense of pride when I see them moving forward in the direction that they want to go in.
Thanks to Silverani and all the other people that helped, I can at least move around now and do whatever I want to do almost,